I am Rebecca Owens, the founder and CEO of Swellter. Swellter is an emerging healthcare technology platform that is on a mission to ensure that every cancer patient and their physicians are receiving and have access to education and testing and treatment opportunities at the most critical times in decision-making. Beyond my 22 years of experience in cancer diagnostics, I have personally been impacted by this awful disease. On February 17th of this year, I lost my father-in-law to stage 4 melanoma. At a terminal diagnosis, he was told that he had 3 months to live with an inconclusive radiology image. I don't know about you, but I believe that we had to look for other options. Because of my background in cancer testing, I was able to get him a novel test that would, one, tell us whether or not he did have melanoma in the brain, and two, present us with potential treatment opportunities and/or clinical trials. Every person that you see on my screen is a close family member of mine and a friend who have suffered and gone through the exact same stories as my father-in-law. Although we lost him on February 17th, I can tell you that we got 14 months with him instead of 3. We are comprised of a leadership team with more than 60 years of combined experience, specifically in healthcare informatics, real-world data, cancer diagnostics, cancer care, and user experience. We have launched some of the most innovative strategies and solutions at some of the leading companies in our space. So let's really address the real problem. More than 17 million people are living with cancer in the United States, and more than 1.7, actually now the statistics are more than 1.9 million, cancer patients will be diagnosed each year with cancer. And what will shock you is more than 60% of cancer patients are not receiving the appropriate testing that could determine their best treatment options or guide them to a clinical trial. Additionally, the methods that we're currently using to educate patients and physicians about these very complex therapies and tests are costly, outdated, and quite honestly, ineffective. You can think about the commercials you see on TV that most of us are probably scared about, the side effects, and they're just too much for the companies to continue to spend and continue to be ineffective. So how is Swellter addressing this? Swellter is a web-enabled, mobile-friendly application that is encountered at the oncology first visit, and we present the patient, through patient consent, the most optimized treatments and testing opportunities relevant to what is in their medical record. But we also know from our experience, you cannot just educate a patient. You have to educate simultaneously the clinical staff and the oncologist. We have to drive additional insights that must be leveraged, that cannot be seen or utilized in their medical record. And we also have to be able to help the clinic and the physicians turn these insights into action. But where our innovation lies, many of people have encountered what we call patient engagement applications, which require a patient's input into a mobile app. But on the far left of my screen is where our innovation lies. We leverage the medical record, the database, in real time, again, leveraging patient consent alongside their physicians, and we dynamically inform the app as the information in your medical record changes, we inform the application. Just like my father-in-law, he would have learned about that novel test if he had our application. The healthcare technology landscape is exploding thanks to COVID, and we have seized the opportunity to build this application, and we do believe that we have an opportunity to achieve $100 million in market share. How we make money is by a subscription-based model. The people who are most qualified to tell you about a test or a treatment are the pharmaceutical companies and the laboratories who develop these tests. So we developed a subscription-based model where they deliver their patient-facing education and the clinic-facing education through our application. Thank you for your time and the opportunity to present to you. I am available for questions after the show.